Sarah, and this is my research proposal presentation. So the overall problem statement for this study was looking at how housing instability influence mental health outcomes in individuals. So kind of went beyond just looking at surface level mental health symptoms and diagnoses. It was really to look at investigate lived experiences of individuals and how that impacts their mental health. The mission was to understand how unstable housing creates or prolongs different mental health struggles. In this case, we specifically looked at depression and or anxiety disorders. It also took into account biological factors such as sleep, poor nutrition, and stress levels. Also looking at social factors such as loneliness, lack of social support, exposure to different unsafe environments, and how all those things work together to impact different mental health struggles like depression and anxiety. We also are looking at identifying different patterns, risk factors, essentially looking for that cause and effect relationship between housing instability and individuals' mental health. So the research question that was mainly focused on in the study was how housing instability impacts mental health outcomes among individuals experiencing conditions such as depression and anxiety disorders. Some subsidiary questions to kind of go along with that was what type of mental health conditions are most commonly associated with unstable housing? How does housing instability link to higher rates of substance use disorders? How does that play a role in it? What interventions are most effective in improving both housing stability and mental health conditions? And then for the PICO, so like how I did my research study, what I focused on, P was population or problem. So that was the individuals experiencing mental health conditions such as depression and anxiety disorders. I was the intervention, so housing instability. So that was defined as homelessness, frequent moves, unsafe or temporary housing, such as like shelters. Comparison was C, which was individuals with stable housing, comparing them to individuals with unstable housing, and comparing their mental health. And then outcome was the different mental health outcomes. Symptom severity, frequency of crises or hospitalization for mental health, just overall psychological well-being of people. For the literature search, some terms I was just searching to kind of help me was depression or anxiety, housing instability or homelessness, mental health outcomes, or psychological well-being. Those were just some of the sources that I used. And then for information on population, depression and housing instability was searched. And then for the outcome, to get some information on outcome terms, kind of combining everything, depression, housing instability, and then mental health outcomes. So the sampling design that was used in this study was purpose-fied, stratified sampling design. So the target population was adults or individuals over 18 who are currently experiencing housing instability. So whether it be homelessness, temporary housing, or currently maybe like at risk for eviction, as well as having a documented diagnosis of depression or anxiety from a medical professional or mental health professional. The participants were selected from community-based organizations, so different shelters, outpatient mental health clinics, different inpatient hospital units, and then anyone that really serves individuals experiencing housing instability. Stratified based on type of housing situation, so again, whether that's sheltered, unsheltered, temporarily housed, just to ensure there's equal representation among all the different subgroups of the levels of housing instability. So a little bit more on the sampling design. For each group, participants were chosen using, again, the purpose-fied sampling to ensure that they meet the criteria of housing instability and also have the diagnosed mental health condition. The criteria as followed: 18 years or older, experiencing housing instability, and then having that documented clinical diagnosis of depression and or anxiety disorder. People who were not eligible were people that were not able to provide informed consent, whatever the reason may be, or anyone experiencing acute psychiatric crises requiring immediate treatment or hospitalization. The ability to select participants with lived experience relevant to research question and maintaining representation across the levels of housing instability. Basically, that just allows for more in-depth detailed comparison of mental outcomes between the different subgroups at different levels of housing instability. The theoretical framework for the study was framed and supported by the SDOH, which is Social Determinants of Health. That basically just believes that health outcomes are not just shaped by one thing, they're shaped by social, economic, and environmental conditions which individuals live. It really stresses the role of different systemic drivers such as housing, income, and accessibility to all different life resources, basically saying that all influences our well-being. It's not just one thing. So this study, in conjunction with the framework, basically believes individuals who are exposed to unstable housing conditions are put at a much higher risk of experiencing limited access to healthcare, disruptions in social support networks, or not having any supports at all, and increased exposure to different environmental stressors. Environmental factors combined creates a major disadvantage, and that puts the individuals at a much higher risk for poor mental health outcomes. It understands that mental health is within a larger social and structural context, and basically the goal is to address these systemic inequalities, not just focus on one thing, not just focus on mental health, the individual's mental health. Housing instability was the primary independent variable in the study, and mental health outcomes or symptoms of depression and anxiety were the dependent variables. So the methodology that was used in the study was a mixed methods approach. So it combined quantitative and qualitative data to look at the correlation between housing instability and mental health outcomes. A cross-sectional correlation design was used to examine the associations between housing instability and the severity of depression and anxiety symptoms. The study used about 250 to 300 adults who have experienced housing instability or currently experiencing it within the past 18 months. So again, that means frequent moves, episodes of homelessness, or unsafe or temporary housing. It doesn't just mean they're like homeless and on the street. They're recruited through, again, shelters, social service agencies, the hospitals, different clinics, or online reach platforms. Effectiveness is measured by looking at the extent of how the levels of housing instability are linked to different changes in mental health outcomes. Housing instability was to be measured through structured housing questionnaires. And then for the mental health aspect, depression was measured through Patient Health Questionnaire 9 and anxiety through the GAD-7. Participants then filled out survey questionnaires in either in-person recruitment sites or online via a secure platform. And then the additional 40 to 50 participants from that 250 to 300 individuals were then selected for semi-structured interviews. And it was just to take a look into things further. So, personal stories, housing instability, kind of how that's impacted their mental health, their take on it, different ways they've coped with it, and then how they feel they are accessible to services or not. A little bit more for the methodology, quantitative analysis was then used to analyze all the data collected, descriptive statistics used to summarize sample characteristics. The Pearson correlation was used to examine the association between housing instability and mental health scores, how people rated themselves. Multiple regression analysis to investigate the relationship between housing instability and depression or anxiety outcomes after accounting for different relevant factors. Control variables in the study were demographic variables, so sex, age, race, gender, and any history of substance use, and social support levels. Effectiveness measured by external validity, so whether the sample size is generalizable, whether it's represented, so, to low income renters, urban versus rural areas, how that's impacted, and terms of usefulness, if this could potentially be used to form an intervention to kind of help people. Quickly running through the procedure. So it's a longitudinal observation design to examine the relationship between housing instability and mental health outcomes, markers of depression and anxiety. After screening and informed consent, participants are then enrolled if they meet the proper criteria. Benchmark data is collected at enrollment, and then they complete structured surveys, so just giving some demographic info, housing history, and just getting a basic benchmark mental health status. Housing instability is then looked at through a composite index, so the number of moves, encounters with eviction, housing cost burdens, how they perceive that, or how they perceive just their housing insecurity, whether they feel comfortable in it or not. And then mental health. So then they followed them over an 18-month period. So follow-up assessments were conducted at 4, 8, and 12 months post-baseline. And then I think I forgot to mention mental health outcomes, again, were measured by the Patient Health Questionnaire 9 for depression and the GAD-7 for anxiety. Each meeting, the same mental health assessments were done and discuss current housing status and any relevant life events that may be impacting their mental health. We could take that into account. The data was collected using a combination of in-person interviews, the online surveys, and phone interviews if they were not able to be there in person. To kind of help keep the study going and participants intrigued, they were compensated for each assessment, sent routine reminders, and all the data was kept secure. So it was in a password protected database. Everyone's assigned their own ID. Any identifying info is stored separate from the surveys, and it does get IRB approval before it's done. The statistical analysis will examine changes in depression and anxiety scores over time in relation to housing instability. Some limitations for the study, it does rely on self-reported data measures for housing instability and mental health symptoms, so there is a potential for house response bias for underreporting symptoms. The cross-sectional design limits ability to decide causality. It's not possible to determine directionality just based off that. Confounding variables such as income level, employment status, substance use prior trauma exposure, not fully controlled, so they could influence both housing status and mental health outcomes. There are threats to internal and external validity, so internal selection bias, measurement issues, any external stressors, um, so kind of variability in how housing instability is defined may reduce precision. External validity, so just the generalizability of the study, so it may be limited due to, if marginalized groups were represented or not, different regional differences. So it may not be able to be generalized across different geographic or cultural contexts. So overall, what this means, why I did it, why hopefully it can help in the future, is just to show that housing instability really does truly have an impact on higher rates of depression and anxiety. People who have unstable housing are have less access to mental health services, which in turn really impacts their mental health and puts them at a disadvantage. It really just shows the holistic aspect. It shows how much different environmental factors and social factors impact mental health, not just the mental health itself, but what's driving that to, be worse, to have really people are struggling. Um, it really supports the holistic view on treatment, trauma informed approaches. For social work aspect, it really looks at how housing situations are so important when doing social work assessments or screens, when working with clients with depression and anxiety, that we should be asking those questions: how their housing looked, how it's looked in the past, how it's looked currently. It really impacts mental health, plays a huge role. And it really just shows that CBT is very important. Cognitive behavioral therapy, it's very effective. There's lots of studies on it. We use it all the time. But when it's combined with case management and supportive services, it can really help meet basic needs, um, like stable housing, and it can really help people's mental health. Having a stable environment, a stable support network, a stable, not being worried about eviction or being in a shelter, different things like that can really play a huge role on people's mental health. So it just really shows addressing the person as a whole is super important. So I think the last slide is just my references. So thanks everyone for watching.